is National Cancer Survivor Month, a time dedicated to celebrating the nearly 17 million Americans who have bravely battled cancer and those who are currently in treatment. And joining us to share what you need to know about risk factors, screenings, and cutting-edge treatment is Dr. Hardeep Phull, Director of the Palomar Health Cancer Institute. Welcome.
Thanks for having me, Laura. I'm so happy to be here.
Now, thanks to advances in research, more survivors are living through and beyond their initial diagnosis. What are some preventative measures people can take to detect cancers early and ultimately increase their chances for survival?
There's a lot of things people can do to increase their chances of survival and catch cancer early. For women, that includes mammograms between the age of 35 and 45, depending on family history. Pap smear starting at age 21. For men, we also need colonoscopies starting at age 45. And certain men with history of prostate cancer in their family could start PSA or rectal exam screening starting at age 50. Now, it's also important to remember, we also live in sunny San Diego, and there's a beautiful sun and weather year-round here. But don't forget about skin cancer. So that includes skin protective strategies like sunscreen, wearing long sleeves and a hat, and also seeing your doctor if you have any unusual skin lesions. And for any patient who smokes, I always say, please stop smoking. For really heavy smokers, we do have screenings for lung cancer. Regardless of screening, live a healthy, balanced lifestyle. That means staying active, eating a balanced diet, and avoiding smoking.
And you provide a tailored treatment plan using the latest research and cancer-killing technology, but not all cancers are treated the same.
That's right, not all cancers are treated the same. Sometimes even within a certain type of cancer, it can be treated differently depending on stage and different markers. In this day and age, we measure molecular markers and biomarkers on nearly every cancer. And for many of our advanced cancer patients, we're doing genomic sequencing of their DNA to try to find targets and tailor therapies that will work for them. So it's a lot of personalized medicine, targeted treatment, and adding on of new things to the conventional therapy. The idea is that we're constantly improving, constantly getting better, and making the patient experience better. And of course, changing the outcomes, making people live longer and beat cancer.
And how does Palomar Health customize the cancer treatment plan to match the patient's needs?
I'll tell you, Laura, when a patient gets a cancer for the first time, it's a reaction of fear and tremendous emotion. And we get that. Our goal is to be there with them and guide them through that journey with empathy, with support, and with this sense of empowerment that you've got this, you're going to get through this, and we're going to give you all the tools to get through it. We instantly develop a bond, and then we develop a plan of attack to get them started on treatment, to take the cancer away, and also take the fear of the cancer away to help create a more empowered cancer journey. And that's one of the biggest reasons I became an oncologist, was to meet people at some of their most vulnerable moments in life and guide them through and re-empower them to take control of their lives once again.
And tell us about the technological innovations and therapies that you're using at the Palomar Health Cancer Institute to help patients.
Well, at Palomar Health Cancer Institute, we're always at the cutting edge of technology. Whether that means you need a surgery, we can do a minimally invasive surgery to cut down on OR time and recovery time. Interventional oncology, where we can do the latest radioembolization techniques to kill cancer, where we can map out the body and deliver radiosurgery without even making an incision. And if you need a mammogram, we can also do the best cutting-edge 3D mammograms to catch cancers even earlier. In medical oncology, we can give the most cutting-edge tailored treatments based on DNA sequencing and advanced genomics and molecular markers to find the therapy that's best for you. And we can deliver this in our state-of-the-art infusion center. So it's not just chemotherapy. There might be targeted treatments, biologic treatments, and immunotherapies that we can unlock for you. Lastly, as a medical oncologist, we do DNA sequencing on many of our patients to help find tailored treatments that work best for them. And we have an infusional suite where we can deliver immunotherapy, chemotherapy, and biologic therapy all in one beautiful state-of-the-art infusion center.
No matter the cancer diagnosis, Palomar Health will design a treatment plan using the latest treatment options with the personal care and support you expect when you need it most. For more information, visit palomarhealth.org. Dr. Phull, we thank you so much for your time and insight and these valuable reminders.
Laura, thank you so much for having me. It's been a pleasure.
And we thank you for joining us on San Diego Living. We'll see you next time.